We are here at the Prime Health Summit. It is an honor to be with Julie Reisetter, the VP of Innovations at UCHealth. How are you?
I'm awesome. Thanks for having me.
So first, I just want to thank you for everything that you do and your partnership with Startup Health Colorado and really helping make Startup Health Colorado possible. So thank you for that. But let's start with UCHealth and the mission and what you all are really focusing on in terms of innovation.
Oh yeah, it's such an exciting time. I really feel honored to be part of the UCHealth system and the Startup Health community. So, as a big health system that really represents a microcosm, I think, of healthcare across the U.S., right? We've got large academic medical center, we've got small frontier hospitals, primary care, et cetera. It's really about the patients and the families and helping them have a life and a story that's well lived, so to speak. So innovation is super important to us. It's literally one of our 4 strategic pillars. Even though those other pillars are things such as patient experience or performance, innovation is woven throughout all of those, but in and of itself, innovation is really a strategic priority. And I think that we believe we're well positioned in this great community and really with the help of Startup Health to identify partners, because we can't do it ourselves. So partners, whether they be small or large multinational companies, who can really help us attack our high priority problems. And if we can do that at UCHealth, our bets are on the fact that it probably solves that same problem at the other 400 plus health systems across the country. So we're very, very committed to finding new ways to help solve these high priority problems for our patients and our families.
One of the things we're excited to see is how many entrepreneurs are coming into the ecosystem to focus on innovation. But another trend is how many what we call doctorpreneurs. There's all sorts of physicians that are now creating. Is that a trend that you're seeing here through your systems where either practicing clinicians or what doctorpreneurs are wanting to do more to help with the innovation process?
Yeah, I think without a doubt. And my guess is actually they've always been there, and we just really haven't fostered that in a way that removed the barriers. They're on the front lines, right? So whether it's physicians or nurses or respiratory therapists, I think we have to listen to them and really see what life is like when they're taking care of patients and families, what makes it more difficult. And we really have a guiding principle at UCHealth as we're looking at innovations, in that we're not going to innovate for innovation's sake. We're not going to disrupt their workflow to try to see if something works. It's got to be easier, the path of less resistance, and it's got to make providing care better. And I think the other audience that we haven't listened to maybe enough are patients and families, right? So understanding what their challenges are and working through the lens of those patients and families, again, to make their experience with healthcare easier. So whether it's wayfinding in a big, complex organization like UCHealth, or scheduling appointments, or just the frustration of trying to communicate their information, their blood glucose or their blood pressure in a way that's very traditional. We write it down and we bring it into our physician's office. So I think that these doctorpreneurs have been out there, and we're really just trying to harness that and really, and we've got to have them. They are our subject matter experts, right? So we may have a digital health company that comes in that has a spectacular idea with cardiology. We go straight to those subject matter experts, and they're really the ones that guide this because they know.
And what are some of the lessons learned or advice, I guess, to entrepreneurs, innovators, in terms of making these innovations actually work for your organization?
I guess a couple of things come to mind in terms of really making it work. I think one that we're really committed to, and I'm personally committed to, is working with that community as early on as possible to help them understand really the lens and the environment that they're trying to go into. By no fault of their own, I have run into a number of entrepreneurs that may have what they think is a really great idea, and in and of itself it is, but they just haven't had the inside knowledge to really craft it in a way that's going to work. So, I think finding ways to partner with individuals or with organizations that can give them that inside intel as early as possible is important. And then I think the other thing again is that it's got to be inside the workflow of these providers. We're very committed to that. We've had some very exciting companies, that have figured that out. They've come in and worked shoulder to shoulder with a physician who said, this isn't working here. I don't like how this is. I'm not going to go out to do that piece. And they've been able to figure out how to do that. So it's not easy. You've got to really have someone that can help you make that happen. But I think that the expectation that we're going to throw another app or put another button in a place,
becomes clutter at a certain point.
It becomes clutter.
Yeah.
So it's essential that it's integrated into the workflow if it's something that has to do with the digital technology that would be like in an EMR.
One of the things we're most excited about with our collaboration is really bridging that gap where the entrepreneurs, they're not just off building in a silo, but they're building based off of the needs of that workflow or the clinicians or the patients, and working with you very, very early. So I think that approach is very smart. We're going to be doing multiple calls for innovation together and really activating a global army of innovators and entrepreneurs. What are some of the things that you would like to see more entrepreneurs focusing on to solve the real needs, the real challenges that either patients or clinicians have today?
Probably the best example that I can really give, which isn't as tactical as it is maybe philosophical, is that I've really found that sometimes these entrepreneurs have a hard time articulating very clearly what the value proposition is of their technology. They may say they have a wonderful population health platform that improves patient engagement.
But there's hundreds of those.
There's thousands of those.
Yeah.
So I've actually worked with some smaller startups in a way to say you need to be able to really articulate that in a very clear way, because I don't want to pass up something that's a gem right underneath my eyes. And in this very crowded area of digital health, I think you have to be really savvy in terms of that particular piece and help me know really quickly, what will this do to help patients, providers, and families?
Wonderful, wonderful wisdom there. Predictions for the future. Where there's a lot of hope, there's a lot of optimism. It's an extraordinary time. Great new technologies and innovations, but there's also practicalities. Where do you think things will be over the next, say, 5 to 10 years? And the impact, I guess, for people, for patients?
Yeah. Well, I mean, I guess my hope is that the technology is going to become invisible. There's champions, there's leaders out there that have figured this stuff out, right? We know how to reduce diabetes. We know how to improve outcomes. We know how to leverage telehealth, right? So I think we just have to have really courageous leaders that go out and figure out how to make it happen for these individuals and eventually have it be a world where the technology takes a behind the scenes seat to it, right? It's something that passively makes my life easier and I don't have to work so hard at it.
Yeah, it seems like one of the great areas of innovation, it's not just technology, it's actually design and experience and working in the workflow, as you mentioned. Those are equally as important as the technology itself sometimes.
They're essential. They're absolutely essential. But we'll get there.
We'll get there. So last question, what do you personally do to stay healthy, and what advice maybe for others.
That's one of the reasons I'm so happy to be back in Colorado. I spent a number of years here when I was much younger, and I had this fantastic opportunity to come back. So I look at the sky, I look at the mountains, I ski, I can't wait to mountain bike and just be outside and enjoy the fact that we are in this spectacular state with one of the most exciting ecosystems for
Really
digital
is.
health I've ever seen. I've followed it for years, and it's literally was a magnet that got me here.
We feel the same way. That's why Startup Health Colorado's here, and it's sunny. You see the mountains, the people, the culture. It's just got so many extraordinary things, and it's clear why it really is a great innovation hub for health. So thank you for all that you do and UCHealth does, and all the support you do for the startup ecosystem. It's very meaningful. Thank you.
Absolutely. Startup Health Colorado has been a terrific partner, and it's got a lot of great things in the future. We're going to make it happen.
We're going to do it together.
Absolutely.
Thank you so much.
You bet.